is his quotes, and one of the most famous is when he was talking to a man about orchiectomy who had metastatic prostate cancer. It was a very serious conversation, as I'm told. I wasn't there, but then he introduced the testicles really dress a man up as a way to discuss the side effects of the procedures.
The relevant benefits of LHR.
I'm not sure how to advance it. The next is, the famous Dan quote is, uremia, which is renal failure, is a great way to die. And whenever we would come to Dan with a consult, it didn't matter if it was an elderly patient or somebody that was 24, he would always ask, are you sure the patient just doesn't want to die? He was always cautious about this. He didn't want any interventions that would handicap the patient. And then stories that always make us laugh about Dan are that Dan always knows where the free food is, and he knows exactly how to get there before it runs out. And the best story of this is he knew that Residence Day, Resident Appreciation Day, when it started and when it ended, and we didn't even know that. There's a story amongst the residents of Dan bringing his family into the surgeon's lounge at Sibley, which is well stocked with food as opposed to GW.
It's like last week.
And that last one may not be visible, but Dan always travels by metro, so if you would call him for a consult and say it's 5 o'clock, but I think this patient needs to go to the OR, Dan would say, well, the metro doesn't go to Sibley. Is there anybody else that can do it?
So what Dan's taught us, a little bit more on the serious side, he has taught us a concern for psychosocial details. He would always ask us where this patient is in life, who's with them, what family members are around, what friends they have, what they do. He would always ask us why and how this will help when talking about imaging studies or any other studies that will help point towards a diagnosis. He always asks the question of whether this is going to contribute anything. He always listened before interrupting. This is as evidenced by rounding on consults with him. He could spend probably about 30 to 45 minutes per room. Made for a very long Friday evening. And he made difficult concepts in urology very easy to understand. Why we'll miss you. So next year, we will actually have to bother our attendings to staff our consults, and we won't have anyone to take our patients to the OR at the drop of a hat. You have a lot of patients in the OR, which we thank you for. You have a genuine care for your patients, and you are always a friend before and attending.
Dan, we thank you.
The only other thing that I just want to say is that in a pressure situation where you're in the hospital for a long time and you're under a lot of stress, it's rare that you can think about somebody and say, I have nothing bad about them. I have nothing bad to say about them. But that's truly the truth with Dan. And we're going to miss you. Wish your family the best in Charlotte. And thank you for all that you taught us.